Enabling allows an alcoholic or drug addict to avoid responsibility for the direct or indirect consequences of a drinking or drug use problem. Enabling is something that people do who are in relationships with alcoholics or drug addicts. These could be family, friends, and of course, coworkers. As long as you're in a relationship with an alcoholic or drug addict, it will be very difficult not to enable. Enabling may be covering up for a coworker, protecting the coworker from consequences, accepting excuses without requiring changes in performance, loaning money for financial problems, drinking with the alcoholic or using drugs with the addict, failing to act on disciplinary action if it is threatened if you're a supervisor, or letting your own drinking or drug use interfere with your decision to take a stand and deal directly with your employees' or coworkers' problematic behavior. World's most enabling statement. But he or she is a functional alcoholic. Translation: the drinking problem doesn't bother me. There is no such thing as a functional alcoholic, just like there is no such thing as functional cancer. This term is an example of enabling. In a sense, all alcoholics, if they're alive, are functional. It's a matter of degree. This term is destructive because it helps the alcoholic avoid treatment. How are chemically dependent patients treated? Education about addictive disease. Establishing a 12-step recovery program. Help with accepting the diagnosis. Family counseling. Knowledge to prevent relapse. Treatment of the alcoholic or drug addict is by and large an educational process designed to motivate the alcoholic and help him or her manage the disease in order to prevent relapse. This approach to treating alcoholism was adapted from the treatment of other chronic diseases, such as heart disease and diabetes. Success rates are excellent for employees referred to treatment compared to the general population of alcoholics or addicts who come to treatment referred from other sources. Let's talk about intervention. Intervention can be learned, and the techniques, often taught by a professional, are very successful. The ideas convince the alcoholic or drug addicted to enter treatment. The need for treatment is considered non-negotiable by interveners. No longer do family or friends, the interveners, blame the addict for the addiction. Instead, they make the addict responsible for getting help. This shift in attitude is very powerful, and it makes the defensive mechanism of the addict less useful. Now family and friends become focused, and each troubling incident is an opportunity to convince the alcoholic or addict to get help. Everyone agrees to focus on the goal. The tools of intervention are influence and leverage. Influence is the value of the relationship with the addict. A person with influence has the ability to motivate the addict to consider treatment simply because of who they are and who they represent. For example, a best friend, minister, teacher, even a child. What they say carries weight. Leverage is something that a person can give or take away if the offer of treatment is refused. One of the most common forms of leverage is a court's decision to have a person enter jail if they do not accept treatment. Family and friends can do the same thing, but jail is not the leverage. Instead, they use other forms of leverage they possess: relationships, support, material things, financial support, and privileges. If an intervention does not succeed the first time, it is tried again later when problems recur. There is no one shot with intervention, and therefore most eventually work because the progression of the untreated illness is certain. Talk to your EAP or a professional counselor with expertise in alcohol and drug addiction treatment to learn more about intervention if you decide this is the next step for you.